Welcome everyone to Insight. My name is Nnamdi Odipo. We're in extraordinary times with just about every part of the world feeling the brunt of COVID-19 and the gloom it brings. I mean, it's just almost impossible to imagine what the world is going through right now at the moment. Well, here in Nigeria, the authorities are scaling up activities as part of its national response plan to flatten the curve in the incident rate of coronavirus here in Nigeria. Well, the national response plan will be our focus on this episode of the program. As usual, I've got Elizabeth Omoru here with me. She will be bringing us the media review segment. Elizabeth?
Well, COVID-19, like I said, COVID-19. Well, the federal government remains committed to working with state governments to provide optimal care for COVID-19 confirmed cases in the country. And the Presidential Task Force for the Control of COVID-19 has been updating Nigerians on a daily basis on efforts made so far to ensure that they curtail the spread. Now, the media has been the means through which they relay their updates to Nigerians. The question is, has the media been able to relay properly to Nigerians? Efforts and promises made, have they been able to relate to Nigerians as well, to douse tension, fear and anxiety? So these are some of the areas we'll be taking a look at
very well,
in the media
Elizabeth.
segment.
Very well. We will be bringing you the discussion segment just about now, but you would notice that it is coming with a little tweak. Ajuri Ngulali joins me now. Is the Senior Special Assistant to the President on Public Affairs. Welcome to Insight.
Thank you for having me.
Just before we go on, Ajuri, I'd like to inform our viewer that this episode is going to be somewhat of a town hall. In the house leading to this recording, we sent out a video post, I beg your pardon, asking you, the viewer, to send in questions, and in the course of our conversation, jury here will attempt to give answers to some of them. But before we go on to take the contributions from our viewers out there, let me ask you this.
Service of the NTA. We now join our outside broadcast crew for a live telecast. Please stay tuned.
We are on course, and the basic strategy of the national response is containment. I tried as much as possible to reduce spread, do tracking of those that have already been infected so that we minimize the case of community transmission. And I think we are doing very well. So far, all the processes that have been put in place, the plans, the objectives are being achieved. I listened to the briefing of the Commissioner for Lagos State yesterday, where there was quite a clear indication that the reason for the lockdown and the processes that have been put in place is achieving its desired objective. So I want to thank you, and I would urge you, the media people, to continue to broadcast out there that we need to maintain social distancing. We need to maintain personal hygiene, and we need to report anybody within the community that has shown symptoms of the infection, so that as quickly as possible the help that is desired can be extended to those persons. So thank you very much, and we believe that this facility, I understand, will be commissioned this evening by His Excellency the Governor of Lagos State, and it will be put for the good use of humanity and to the glory of God. Thank you.
Thank you very much. We're going to Bagada for any of you that want to join us. That's what we're going to do. Thank you very much. Oh, you want to follow? Yes. They might.
Yeah, what are you looking for?
Part of this plan, or maybe we are just on our.
We will use this containment period to identify, trace, and isolate all individuals that have come into contact with confirmed cases. We will ensure the treatment of confirmed cases while restricting further spread to other states. Movements of all passenger aircraft, both commercial and private jets, are hereby suspended. Sufficient permits will be issued on a needs basis. However, we must all see this as our national and patriotic duty to control and contain the spread of this virus. I will therefore ask all of us affected by this order to put aside our personal comfort to safeguard ourselves and fellow human beings. This common enemy can only be controlled if we all come together and obey scientific and medical advice.
There is a lot of fake news and report circulating, especially on social media, on the coronavirus. Do not believe or partake in the spread of
relief packages to satellite towns and communities where the most vulnerable segments of the population reside around the lockdown zones. But in terms of the national palliatives, they are truly national, and Cross River certainly will indeed benefit. The last point I want to make very quickly is not only are we looking at the lockdown zones, but the president was very clear in his address that we are obviously thinking ahead about ensuring that we stop the spread into places like Cross River State that don't yet have a confirmed case, which is why you've seen the establishment of new molecular evaluation laboratories to enhance our capacity to test in states where we have not yet recorded a case, places like Maiduguri, for example.
I understand the need for you to be elaborate on some of these issues.
Yes, it's important for our people to understand the details. We can't.
We've got well over
Right.
40 questions,
Right.
like I said, and would like for you
Sure,
to
sure.
attempt as many as
we
possible.
can.
So
Sure.
we'll
Please go
take the
ahead.
next
Yeah.
question now from Lagos.
Right.
Good morning. My name is Ada and I'm in Lagos. I have this question for the government. Okay, so in recent times, there has been several donations to the nation, nationally by corporate bodies, individuals, and internationally as well. Now, my question is actually, how exactly is the government utilizing these funds? Now, we haven't seen in the news or heard on social media or anywhere that government is erecting a standard isolation center in any location in the country, except the one being done in Lagos. Now, we also haven't, seen the government use part of these funds as welfare packages for the people who have to stay at home, especially for those people who earn daily. So I really want to know, how exactly is the government using these funds that have been given to the country in this critical period? Thank you.
Thank you so much, Ada, for your concerns and your question. Let me start from how funds are being managed from the private sector. There's the Coalition for the Response to COVID-19 of private sector actors known as CACOVID. That is being coordinated by 4 different committees. You have the steering committee chaired by the Secretary to the Government of the Federation, Mr. Bas Mustafa, who essentially links the committee with all of the concerned state governments in terms of where certain infrastructure will be located, where certain equipments and materials will be sent to. Then you have the technical committee, which has the World Health Organization, some of the other, the Bill and Melinda Gates Foundation and other technical partners that give us the data that essentially informs our decision to put what infrastructure where. Then you have the finance committee, the funding committee. That is the members who each of whom have contributed over 1 billion naira each. And then you have the operational committee, which is the committee that actually engages in project management, engages in the implementation of the project, oversight, logistics, advocacy, etc. That has to do with the Dangote Foundation, GT Bank, Eco Bank, Fidelity Bank, and other corporate bodies at the organizational level. Now, it's important to note that all of this, I've said all of this so that we have a clear understanding that this is not a government fund, quote unquote. This is not a situation where some private sector actors are throwing a whole bunch of money in a pot and they're saying, government, go spend the money. This is managed by the private sector, funds that have come from the private sector for the sake of Nigerians. As it relates to some of the ideas that, my sister had mentioned in her question or contribution, the idea that there hasn't been erection of new facilities outside of Lagos, I think that's clearly something that we need to educate our people on, because that's false. In Abuja, we have a new 200-bed facility coming up. In Port Harcourt, we've already seen the news where Governor Wike, for example, has been oversighting the construction of a 200-bed facility, not funded by the River State government, however, funded from the center. And then, of course, you have the same in Enugu, 200 beds, and then you have a 500-bed facility in Kano, and an additional 1,000-bed capacity coming up in Lagos, including the 110-bed that was just unveiled at Onikan Stadium. So there's a lot going on, and that does not even include the development of new molecular evaluation laboratories that we've seen come up in Port Harcourt, Kaduna, Kano, Abakaliki, Ebonyi State, and many other areas in the country. So there's a lot of work going on, and it's managed by the private sector, the funds that are coming from the private sector.
I hope that answers your question, Ada. If you're watching, well, we'll move on very quickly to the third question now.
Hi, my name is Aisha Musa Saleh from FCT Abuja here. And my questions are, is it really a good idea to open the market every day? And do we have persons on ground making sure that the rules on social distancing are being kept? Regarding the issue of opening market every day, we have people moving around the city, and we're not even sure if they're going to the market or the hospitals. Who is on ground making sure that these people are not going to visit relatives or even attend small gatherings around? And my second question is, do we have regulatory bodies on ground penalizing the shops, stores, supermarkets, and even markets, even the local market people on price hiking? Prices are bizarrely high and people with money are complaining. Then what happens to people that don't have the money? People that don't have the money or wait for others to give them the money cannot even purchase this food items because they are unusually high right now. So we want to know what the government is doing or will do regarding this issue. Thank you.
Thank you very much, my sister. I think her questions are very, very apt and intelligent. And let me just start from the point of the restriction that's been put in place in terms of market access between 10 a.m. and 2 p.m. To answer her question, yes, it is restricted, which means that you can't put a restriction in place without forces that would regulate and ensure the enforcement of those restrictions. We certainly have personnel doing that, not just security, by the way, but also public health personnel, so that people are passing through the protocols that they need to pass through in order to access these facilities. But I also want to emphasize that there's no way that we are going to effectively tackle COVID-19 in this country if the assumption is that all of us are just looking to government to solve the problem in a silo. We all have a role to play. What that means in the context of what she has asked is, if you're one of those who are going to the market to pick up a loaf of bread or a bag of rice or whatever it is, and you see some sort of gap in terms of regulation, or some sort of small gathering that should not be taking place, or even if it's down the street, your neighbor is having a birthday party with 25 people and that's over the stipulated amount of people at this time, then you absolutely do have a responsibility to make sure you call the hotlines that have been given out to the Nigerian public to make sure that we hold those people accountable. So it is a team effort between our people and the government and our people, and that's how we're looking at it. Now, to her other questions about price hiking, we have been very active on this. The Federal Consumer Protection and Competition Council, FCCPC, headed by Mr. Babatunde Irukera, has been very, very active, not just in actuality in the physical, but even on social media online, has been very active in terms of saying, look, if you have any complaint anywhere. You tell us the store, you tell us the location, we will go there. And he's been out and active in making sure that I think there's even a lawsuit that has been filed against some individuals who were in a very unscrupulous manner hiking the price of hand sanitizers. So government is taking action, and we're going to continue to, but we certainly need the cooperation of our people.
Just before we go on to the next question, I'd like to ask you this: are you satisfied with the impact that the restriction is making, or are you achieving as much as you hoped to achieve with the restrictions in place?
Absolutely, and I think this is an area where I just want to compliment and appreciate our people, because they have really been on the large scale very cooperative with us in terms of not coming out unnecessarily. We don't have situations of many people coming out without a real need to come out. So we're encouraged by what Nigerians are doing, and we're just asking for more of it. With that said, for us, the restrictions have enabled us to do the following. When you're contact tracing thousands of contacts across predominantly the 3 zones where you have the most of the bulk of the approximately 3,000 or 4,000 people that we're now looking at, the restrictions have allowed us to, in a very uninhibited fashion, without having to worry about road traffic, without having to worry about going through so many multitudes of people, we can actually access those people where they are, particularly because most of these are aviation based. And when these people were coming in from overseas, many of them were intentionally putting wrong addresses, wrong numbers, which means that you now have to trace them on the basis of the information given to the airlines. That is a long thread of investigation that has to go on before you can identify where they're coming from, where they live, where maybe their brother or sister lives, so that the brother or sister can tell you where they live. And that's the kind of contact tracing that we're involved with. So the restriction has certainly enabled us to do that most effectively.
All right, then we'll go to the very next question.
James Komolafe, team lead at Saba Resources. As a behavioral therapist, the effort of government is quite commendable, especially the presidential speech on COVID-19 last Sunday. 2 strategies were reeled out: profound, preservation and protection. I believe the third strategy lies with the people, which is the production. Now, what effort has the government made or is making to ensure that people don't run riot into the negative side and consequences of lockdown? We need to educate them to be able to cope well and be productive. And then secondly, what are the post-COVID-19 policy frameworks government is developing on a behavioral note in order to institute a policy framework for national development? Because prevention is better than cure. Thank you.
I very much agree with my brother. Prevention is better than cure, which is what necessitated the action of the president in the first place in terms of the lockdown. There are a series of things you mentioned. The behavioral attitudes and trends of our people during this time. I've already discussed that a little bit in saying that we've been very pleased with the reaction of our people. They have very much, in large part, complied with government directives, and that has helped us immensely in terms of protecting all of us from the further spread of the virus. The other issues he raised had to do with the post-COVID-19 era, what frameworks are in place. Very, very, very important question. And, first of all, the president just directed, I believe it was last Monday, the constitution of a brand new Presidential Economic Sustainability Committee being chaired by Vice President Professor Yemi Osinbajo. That committee is very, very crucial for multiple reasons, and we want to make sure that our people are sensitized about this. Not only is that committee dealing with how to evolve new palliatives that are direct to the citizens of the country in a way that is free of corruption, in a way that is free of resource misappropriation, in a way that's more automated. We want to try and leverage on the technologies provided by, obviously, the Nigerian Interbank Settlement System, NIBSS, the BVN, to ensure that whatever interventions we're making are in a form that will get to our people as desired and not in any way diverted. So we're working very hard hard on that on a large scale. And also, in terms of the post-COVID aspect, the committee is now saddled with the responsibility of developing a long-term economic plan for the country for the post-COVID-19 era, which is going to obviously involve targeting those sectors with large-scale cash interventions, liquidity interventions, to ensure that we are able to expedite the process of moving from self-sufficiency in food production, for example, into export dependence, so that we can diversify the economy away from the volatilities and whims of the global oil and gas market.
Okay, great, Ajay. We also have a couple of questions, coming from outside of the shores of Nigeria. We do have a question from someone from a Nigerian based in the UK. I think we'll take that now.
Good afternoon, Mr. Honorable Advisor to His Excellency. My name is Mr. Ugachukwu Uchebu. I live in London, United Kingdom. My first question is this. There is a rise in panic level, which is fueled in many cases by misinformation. So how much of a threat do you think misinformation and panic is affecting the country's fight against this pandemic? And my second question is this, sir. We understand the enormous demands that it requires in resources to fight this pandemic. I would like to know, sir, what does Nigeria as a country have at its disposal to battle this invisible enemy?
Thank you very much. Let me start from the first point, about misinformation. Misinformation has been a huge threat across the social media landscape. You're seeing fake news reports about the Minister of Humanitarian Affairs, allegations that she's handing out money to only a certain ethnic group and not other ethnic groups. Other divisive content about an outbreak of COVID-19 in Kano that did not exist, and all of that. That makes everything more difficult, because when a small group of our people decide that they are going to sow distrust into the environment, what it does is it undermines the credibility of the government in the eyes of those who are needed to cooperate with us in order to maintain our comprehensive overall security as a country. So all of us are at threat of misinformation, not the government, but all of us, because it undermines our ability to work effectively with our people. With that said, we counter misinformation with information. We counter falsehood with truth. We make sure that on a daily basis, almost on at least 2-3 times a day, you're hearing directly from the NCDC with the updated case levels, how many cases, where are they located, how many deaths, if there are any, how many rehabilitations or discharged patients, if there are any. So we are up to date in real time, and the reason why we do that, even when the news isn't good, even when we have 20 new cases in a day instead of 1 new case, we make sure that information is out there, because it's not about whether it favors government or not. It's about whether or not we're being honest with our people, so that we have the credibility to be effectively cooperated with by our people.
All right, great. So we'll take another very quick question, this time again from outside of the shores of Nigeria.
My name is Paul Arnold Dinamiti. I am in Cyprus. Is the Nigerian government seriously considering evacuating its citizens from abroad? And is there any development on Nigeria producing its own cure? So it's a cure in development in Nigeria. Thank you.
Fantastic questions. On the first part about whether we're evacuating our citizens abroad, yes, we are. The CEO of the Diaspora Commission, Mrs. Abike Dabiri, has already come out to tell Nigerians that we are working out the modalities of doing exactly that. And not only are we doing so, but we're also on the other question in terms of whether we are making moves toward a vaccine. What we're doing in large part is we're focusing on tackling this crisis, not with the present view in mind only, but with the future in mind. What I mean by that in practical terms is we have put in place a 100 billion naira intervention for the healthcare service delivery system in the country, to ensure that we create the infrastructural backbone that would now support our very talented medical practitioners that go to the US and UK and thrive, but don't thrive as much here. We're trying to solve that, bridge that gap. How we're going to do that that is we're going to establish research and development and innovation laboratories across public health institutions around the country. We are offering major facilities, large-scale facilities to Nigerian drug manufacturers to expand existing drug manufacturing plants in the country that will employ our people, that will reduce importation. And we're also extending major facilities out of the 100 billion to private hospitals that have a proven standard that they can use to expand their ICU units and some of the things that are very, very important looking ahead. So all of that is in play. But in terms of the vaccine, it's very clear that globally there is about a set of about 3 to 7 companies that are working on a global vaccine where you have billions of dollars being poured in from all sorts of governments around the world and philanthropic organizations like the Bill and Melinda Gates Foundation. They have made it clear that there will be no vaccine for COVID-19 until a band of about 12 to 18 months have elapsed. So we're still a ways off. We still have encouraged our indigenous scientists to embark on that journey, on that process to see what can happen, and we are supporting them wherever they've asked us to. Certainly that's the case, but we're also aware of the global dimension and what is being invested in terms of a global vaccine.
Great. So we'll take another question very quickly, but this time I think we'll come back home and we'll take a question from Lagos.
My name is Tayo George, based in Lagos. I'd like to commend the federal government for the palliatives provided to the vulnerable and the poor during this period. However, there are concerns that some of those items are not sufficient. People have been saying that maybe there's a problem somewhere. It's whether you give a bag of rice to so many people, it's not even sufficient. So of what use is this? I think measures should be taken to check how far these things go. It's very important so that at the end of the day it will amount to what are the efforts put in place to check this?
Thank you very much. We've kind of touched on that a little bit, but I'm going to go into a bit more depth so that our people are not misled by anyone as it relates to what is happening in terms of the palliatives. First of all, let's appreciate where we are economically. Right now, we have seen our crude oil revenues, which is obviously 90% of our export earnings as of today, cut in less than and more than half, right? We are in a situation right now where in terms of the federal allocation to states, for example, in FARC, has gone from about 600 billion naira on a monthly scale down, we're looking at by June to probably get down to about 400 billion across tiers, across states. That is not good. So what that means is when we talk about palliatives, we have to be very, very aware of the fact that our economy is not today what it was 6 months ago when the oil price was normal. This is the way it is for economies that are still working to diversify as we are. So this is the reality. Now, with that said, the palliatives are as follows. I've mentioned the 1 trillion naira fund from the CBN, 1.1 trillion, which is manufacturing, agricultural facilities. That includes the healthcare service delivery injection, as well as the 50 billion for micro, small, and medium-scale enterprises and households across the country. But in terms of the direct palliatives, I've mentioned that the Economic Sustainability Committee is breaking, as we speak right now, are working out the details of the direct interventions that are going to be made. As soon as that information is available, it will be given to the public. And I also want to just quickly mention that we have a 500 billion naira special intervention fund, which is going to fund a series of public works programs that are going to employ.
That's the stimulus bill before.
That's right, 500 billion. That's not only going to include direct cash injection, but it's also going to include financial incentives for MSMEs across the country who refuse to sack their workers during this temporary time of hardship. We're looking at how we can maybe give them some tax credits and some other things to ensure that they don't lay off Nigerian workers.
We're going to attempt to take a couple of questions in quick succession because we're fast running out of time. So we'll take 2 questions back to back and we'll make you respond to these 2 questions immediately.
Hello, good day. I'm Dr. Chris Ifediora. I'm an associate professor of medicine that lives on the Gold Coast in Australia. I'm from Anambra State of Nigeria. I'm very pleased that this program is going on because Nigerians need to be enlightened. I have a couple of questions for you. The first one concerns the quarantine system in Nigeria. It is a very commendable program, and I'm very pleased that the federal government acted to close off the borders. But my question borders on people coming back to Nigeria, like myself if I should come into Nigeria. I understand there's a quarantine system where people are supposed to self-isolate for 2 weeks. That is very good. But in reality, how possible, how much is the federal government doing to implement this?
Okay, so that's the first one. Right. So I'll play this.
My name is Chuma. I run the design firm in Lagos and a social enterprise design hub. Part of what we do is social innovation. So I'm very curious and I'm very intrigued that you're here, sir. My question to you is, beyond all the money that has been donated and all of the response that people have made, I'm a bit worried about how post COVID-19, how are we going to ensure that we have a sustainable plan in place that will help us fight some diseases, as opposed to this knee-jerk reaction of, okay, oh, there's money, oh, something happens and then we react. How? What are your plans in place? Does this provide an opportunity for us to now actually develop a sustainable healthcare system?
Thank you very much. So let me just start from the first question, which was...
And sorry, Adri, I'll butt in here. If it's possible for you to take that in like a minute, more questions.
We'll try,
and so we can also see if we can take 2 more questions just before we
that would
wrap
be
up. Yes.
Thank you very much. As it relates to the question about returnees, we've been very clear that our people are our people, and we have to take care of our people. If they're coming in, we've had instances, obviously, of the land border. Some returnees from the Ivory Coast came in, some of whom had COVID-19. We were able to very quickly act and make sure that before they got into the country, we were able to screen them, put them through the testing protocols, which is how we found out about it. We were able to isolate them, quarantine them, and then those that were not affected are under surveillance as well. So we have the mechanisms in place to ensure that we return our people in a way that is safe for the people who are already here.
And then the question from Chuma in Lagos?
Yes, the question from Chuma about the sustainable healthcare system, I addressed that with the 100 billion naira injection that is for that purpose. But in addition to that, some of the other mechanisms we put in place, the 13, we started out this crisis with 5 molecular evaluation laboratories nationwide. We are moving up to 13 molecular evaluation laboratories across all geopolitical zones within the next 10 days. These laboratories are not going anywhere. They're not going to be brought down or anything like that. In terms of some of the permanent structures that we're putting up around the country, they will not be brought down either. So, look, we are committed to it. We are laying out the plans very clearly, and we are going to abide by those plans.
We're absolutely out of time, but we'll just take one question, and you use that to round off.
Hello, my name is Imewori Ohiomokai. I am a media personality based in Abuja. My question for Mr. Ajuri Ngelale has to do with the COVID-19 palliatives. Who were those who benefited from this COVID-19 palliatives? I know there's a social register and all that, but can we know how many people, especially from the southern part of the country, that benefited from the COVID-19 palliatives? We would like to have the exact numbers. Then secondly, there is this figure that's been flying around that it's about 2.5 million households got the COVID-19 palliatives. Can we have a breakdown of these 2.5 million households? I am aware also that in Imo State, no palliative was given, and in some other parts of the country. So please, let's have this breakdown. Thank you very much.
Okay, because we're fast out of time,
question.
and so it may not be possible for you to take both questions.
Right, but he actually asked the same question twice, so I can just quickly handle it.
Great, very quickly,
yes.
Just in a few seconds.
That is one of the major rumors around the country, is that somehow we gave palliatives to 2.6 million people that were claiming that. We never claimed that. What happened was the Minister of Humanitarian Affairs said we have a social register in the NSIO of 2.6 million Nigerians. She never said that 2.6 million people have already been given palliatives. What she was saying is we have a register that we are going to use to give the palliatives over a period of time. So we have not even claimed to have done so. And the issue of spread across the country does not arise. The recent handout of resources to some vulnerable citizens included a handout process in Anambra State last week.
We're going to have to take this up in another episode.
Sure,
apparently, it's clear that we do not have enough time to take, and I'm going to have to apologize to our viewer out there. We got massive response from you when we asked you to send these questions. We actually got close to 100 questions. We had to just pick these ones, and owing to the fact that we have limited time, but we're promising you in our subsequent bulletins, rather in our subsequent episodes, we will be bringing you some of those questions, and we will be bringing back a jury to take on our attempt to answer your questions. During Galali, we've had an exciting time getting clarification from you on some of these issues. We hope that you will be back here when we invite you next time to come further clear these issues. We've been speaking with the Senior Special Assistant to the President on Public Affairs during Galali, and now take you to the next segment of our program, of course, which is the interview segment. My second guest is Dr. Nu Solomon Ayegun. He is the Deputy National President, Environmental Health Officers Association of Nigeria, and also the Provost College of Health Sciences and Technology in Ida, Kogi State. Welcome to Insight.
Thank you very much.
It will seem that you're even more visible right now, as in when you go around parts of the country in states generally. I see your officers and members engaged either in the contamination of fumigation, as it were, working with the state's government. Why is it that it took a pandemic as impactful? Of course, this is something happening on a global scale. For us to see your officers and members working quite visibly across the country.
Yeah, this matter belongs to us by the grace of God. When we talk about disease prevention, that is the aspect that we're supposed to feature very prominently. And we have our officers at the different states of the federation. We have at the local government level, we have at the state, and we have at the federal level. At the federal level here, we have our agency, the regulatory agency, Environmental Health Officers Regulation Council of Nigeria, in collaboration with the Federal Ministry of Environment. And we have our officers too at the Federal Ministry of Health. But basically now, those that are doing the decontamination at the federal level now is the Federal Ministry of Environment in collaboration with the HORECON, Environmental Health Officers Regulation Council of Nigeria. They are the ones that know about vector control services. They also know about decontamination because the environment is affected. And basically the professionals that has to do something with the environment is the environmental health officers. And that is why you see government calling on us to come up to be able to carry out our work, to be able to really prevent this outbreak to getting up to a very alarming proportion.
So this is not a coordinated exercise. You seem to be working with the federal government on the one hand and with states on the other hand. Is this a coordinated or isolated, or maybe not isolated? Do I just say it is a two-pronged approach for you, federal on the one hand and states on the other?
Yeah, when you know about federalism and the federalism that is taking place in this country, the states are there on their own, the local government is there on their own. But again, they collaborate. There is coordinated activities. But remember, this time around, the activities that is being carried out is based on the occurrence of this particular infection. Take for example, now in Kogi State, we do not have any case of confirmed case of coronavirus infection. So there will be no need to be doing decontamination, disinfection in that particular place. But in Lagos State, the number of cases that are confirmed is alarming. And that is why, too, the environmental officers, they have to rise up alongside with the state government to do something so as to ease and to bring down or curtail the rate at which the disease is spreading.
When you say in Kogi State, because they do not have a single confirmed positive case of coronavirus, that wouldn't warrant you decontaminating public places as against Lagos, where there are several cases which necessitates the need for decontamination. Doesn't that bring to fore the issue of our very nature towards preventive measures and towards hygiene in general? Because we would rather respond or be reactive to a situation than being proactive to a situation. Shouldn't we take preventive measures already, like in places like Kogi, and begin to decontaminate public places rather than wait for an incident to occur before we now commence decontamination and fumigation?
Thank you very much. That is the general problem of this country. Before now, government's priorities is on curative healthcare rather than preventive, because there is this common saying that prevention is better and cheaper than cure. We're supposed to be doing that all this while, but there is no mobilization. And these are the things we are out to correct now. Government of Nigeria seems to be reactive, defensive. When there is an outbreak of a common communicable disease, it ought not to be like that. And by the grace of God, I think what is happening now is an eye-opener to us, that we need to pay serious attention to preventive healthcare rather than curative healthcare. So, but dealing with the matter at hand, because this time around government need a lot of resources, where they are trying to get isolation camp, get hand sanitizers, nose muff and all that, and paying those that are carrying out services, getting drugs and all that. So the resources now, it seems to be meager, and I believe that is why they are trying to prioritize what to do. If not, the contamination, disinfection is supposed to be an ongoing thing. Because when we're talking about infection, it's not only coronavirus. Exactly. Remember, even before coronavirus came, there's this Lassa fever. There are other diseases like cholera infection, mebiasis, and so on and so forth. These are communicable diseases that are in the disease agent, the causative agent, the pathogenic organisms are found in the environment. So this is supposed to be an ongoing thing. But now that there is a lot of problem in our hand, we have to prioritize our needs because it is being carried out in the midst of meager resources.
I'm sure you're aware that there is no known cure right now for the COVID-19. For coronavirus, as it would seem. Yeah. And I'm also sure you're aware that what agencies, authorities, actually even the World Health Organization, what they put forward, one of the measures they put forward to curbing the spread or further spread of coronavirus is personal hygiene. Yeah. We've been asked and tasked to engage in personal hygiene, and also in addition to social distancing and physical distancing as well. Give me, and very quickly too, give me a general outlook, like a quick assessment of the environmental health services in Nigeria.
I think this particular disease occurrence has really opened the eyes of the members of the public and even government as well. There is negligence to environmental services before now. And the major parameter with which we used to know, or the major indices with which we know that we are not doing well is the occurrence of common communicable diseases in our country. One of our former registrars, in the person of Dr. Ebisike, said, and I quote, he said, the major indices with which we measure the successfulness of environmental services in any nation or state is a drastic reduction in the occurrence of common communicable diseases, and if possible, total elimination. But with outbreak of common communicable diseases here and there, Lassa fever is there, malaria fever, dysentery, and all these communicable diseases, typhoid fever in our country, that shows we are not doing very well, because that is what we can use to measure ourselves. So if these diseases keep on occurring, even in epidemic proportion in our nation, then we are not taking care of sanitation very, very well. Now, look at the components.
What is the problem? Is it because there are not enough environmental health officers right now, or is it because we have a people problem on our hands? It's a behavioral pattern.
Thank you very much. It's a multifactorial issue. The factors are so many. It comes from the aspect of government. There's the aspect that belongs to our people, our environmental health officers, and the aspect of lack of resources. Now, take for example, it is stated that in every health facility of any nation, the environmental health department or unit is supposed to be established. But look at our health facilities, our hospitals. How many has an environmental health unit that is attached to a particular hospital, particularly to deal with all this clinical waste? In every health facility, we're supposed to have an incinerator to deal with this, clinical waste. And they are not available. And that is why we should be more afraid. If there is any terrible disease, communicable disease occurrence, it can easily spread because we do not have an organized means for waste management. And again, we do not have enough environmental health officers. Some of them are already have retired, and some of them are dying. There is no replacement. If you go to Federal Ministry of Health now, I don't think you can see up to 5 environmental health officers there. Most of them have reached the directorate cadre, they have retired. And government do not see the need to employ them. Then how do we see the continuity of this work? Then what of the logistics, the equipment? I was talking about, equipment for environmental monitoring. We have different equipment. They want to measure the noise. They want to measure the air. They want to measure what the components of the soil and all that. They are not available.
Dr. Ayogo, we're running out of time. But just before I let you go, and very quickly too, in going forward, I mean, what do we do in sustaining action in terms of environmental health services in Nigeria? Very quickly.
Thank you very much. I will advise that since coronavirus is what is driving us to do what is needful now, I think some of the equipment that the various state governments are procuring should not be sold out. Because there is every tendency now, if we have been able to bring this coronavirus infection under control now, by and large, the equipment that they're using for decontamination, disinfection in different parts of the city metropolis may be sold out. No more procurement of chemicals. So now that we have the understanding that environment is contributing a greater percentage to disease causation, we should keep those things. Where the state that have not procured them, they should procure them. And they should employ more environmental health officers so that there will be continuous sensitization, continuous health education, so that there can be sustainability of action.
Dr. Ayogo, thank you so much for coming on Insights. I want to join millions of Nigerians out there to commend you, commend your members and officers for going all out there, for being in the forefront of this fight against this invisible enemy. I want to tell you that you have the support and backings of millions of Nigerians for what you're doing out there. Thank you so much for coming on Insight. We've been speaking with Dr. Nuhu Solomon Ayogu. He is the Deputy National President, Environmental Health Officers Association of Nigeria, as well as being the Provost, College of Health Sciences and Technology in Ida, Kogi State.
Yeah.
Up next is the media review segment with Elizabeth Omoruyi.
Thanks for joining us on the media review segment of the program. Today we shall be taking a look at the briefings by the Presidential Task Force for the Control of COVID-19. How far have they gone? My guest, Mitari Ikmen, who has been following up on the briefings, will give us details. It's nice to have you on the segment.
Thank you very much.
All right, could you tell us the briefings? How far were the briefings?
Okay, basically the Presidential Task Force on COVID-19 was inaugurated to strengthen the national response to fighting the pandemic. And the national response revolved around testing, containment of the pandemic, contact tracing, and all of that. In the aspect of testing, from 4 testing laboratories initially, the PTF, that's the Presidential Task Force, have been able to scale up to 8 laboratories around the country.
Okay.
And also in the aspect of contact tracing, we hear that as a result of the lockdown of 3 states, that's Lagos, Ogun, and the Federal Capital Territory, which is part of containment measures, the Nigeria Center for Disease Control is currently tracing about 6,000 contact cases of COVID-19. So these are some of the measures taken by the Presidential Task Force to basically strengthen the national response strategy in the areas of testing, in the areas of contact tracing, and also containment of the pandemic in Nigeria.
Okay. Now, most Nigerians are really concerned with the issue of tracing, contact tracing. How far have they gone in this regard?
About 71% of these contacts are being traced by the NCDC, and they are able to scale up the tracing of these contacts because of the lockdown in the high-risk territories in Nigeria. That's talking about Lagos, the FCT, and Ogun was added because of its proximity to Lagos. So they are already follow up on these cases, and we expect that in the coming days they should be able to catch up or track all of the 6,000 contact cases that they are tracing, and we expect that they will also scale up their testing capacity, because it's one thing to trace all of these people and it's another thing to be able to test them within the window or time required for testing. I understand that it takes sometimes up to 3 days for the samples to be taken and the results to be obtained, to come out. Exactly.
Okay. Now, the issue of lockdown, has it been able to help the presidential task force to achieve its objective?
Significantly, because initially the NCDC said it was tracing about 5,000 contact cases, but after the lockdown, I think that number scaled up to about 6,000, and perhaps even more. And I think it was because of the lockdown and the fact that they said they are using an electronic tracking system to be able to follow up on all these contacts. And again, the lockdown has helped, because when you say people should sit at home, it also gives the opportunity, the leverage to move around and to be able to follow up on all these cases. Although the consideration given, we hear that the consideration given by the task force for Nigerians who are in the affected states to shop for food supplies is at a time was being abused by people to just come out between that 10 to 2 p.m. window, you know. But even at that, the task force is still trying to strengthen all its containment measures and enforce the restrictions using the security agencies to be able to manage the pandemic in the country.
Some states do not have any case at all. So what is the PTF doing to ensure that the virus does not spread to some of those states?
Yes, the PTF is intensifying synergy and collaboration with the subnational governments, especially against the backdrop that initially, even before the federal government announced the lockdown of the 3 affected states and territory, you will discover that a lot of other states have started taking their own measures and their own policies.
Yes.
And you will discover that it will seem as if some of these measures and policies sometimes conflict with what the federal government has said. So, bearing that in mind, the Presidential Task Force led by Secretary to Government of the Federation, Boss Mustafa, is in constant interface with the state governors, and they have been told to establish a 300-bed isolation facility in their respective states in the event that, which we don't pray for, but in the event that the pandemic in Nigeria should progress to community transmission, then the subnational government will be ready to handle these cases. So the Presidential Task Force, through its chairman, is constantly interfacing with the state governments to make sure that they harmonize policies and they make sure that there's no conflict of policies.
Okay. Now, before I let you go, the issue of social distancing is there. How firm is PTF on this?
Yeah, the PTF, as it were, is working with the security agencies to enforce this. In the Federal Capital Territory, for example, you know, the PTF, they have the FCT Enforcement Task Force, which is going around, even though there is that consideration for people to shop in the neighborhood markets, between satellite town markets, between the hours of 10 a.m. to 2 p.m., you know, the enforcement teams and the security personnel is going around to make sure that social distancing and other measures, other containment measures are being observed in the various localities.
Okay. I want to thank you for your time. Thank you for sharing your thoughts with us. And I hope you give us more details subsequently.
Certainly I'll be here and I'll be glad to give more details, especially as they unfold.
All right. Thank you so much for your time.
Thank you very much.
And that's it on the Media Review segment.
Well, Well, this is where, unfortunately, we'll drop the curtain. It's been an exciting episode for me. I'm sure it has been for you as well. I would promise you this. We will be bringing you a continuation of the discussion segment that we had with Ajuri Ngalale earlier, so that we can accommodate the other questions that we've left out in this episode. Elizabeth?
Well, I think social distancing is key at this point. It's no joke, so let's just observe it. It's necessary.
Okay, very well. Join us same time next week for more on Insight. My name is Nnamdi Odigbo.
And I'm Elizabeth Omori. We'll see you next week.